So we are back now with the new research that's bringing new hope for breast cancer patients.
Data indicates a drug that's already on the market could dramatically reduce the risk of recurrence of breast cancer. ABC's Eva Pilgrim has the latest.
Exciting news for those diagnosed with early-stage breast cancer.
Breathe and relax.
New research reveals the drug ribociclib, marketed under the name Kisqali, can lower the chances of recurrence for many of those diagnosed at earlier stages of the disease. Women who are hormone receptor positive and HER2 negative make up 70% of the breast cancer population. These patients are generally treated with chemotherapy and endocrine therapy, but the study shows adding this targeted therapy will further reduce the risk that the cancer returns.
Women who have this subtype can have recurrences even 20 to 25 years after their initial diagnosis. We found that adding this drug to best available standard therapy will decrease the recurrence rate by as much as 25%.
This is big news for patients like 45-year-old mom Suzanne Garner, diagnosed with stage 2 5 years ago. Doctors treated her with chemo and endocrine therapy.
I didn't feel great. I felt that my risk of recurrence was still too high.
Then she found the Kisqali clinical trial.
I have a young daughter who needs her mom around for as long as possible, and I would absolutely do anything to reduce my risk of recurrence so I can be her mom for as long as she needs me.
All right, thanks to Eva for that. For more, let's bring in ABC News contributor and emergency physician, Dr. Darien Sutton. Dr. Sutton, good to see you. This is great news, isn't it? How many more cancer patients do you think will this treatment now be open to, and what kinds of patients are eligible for it?
This is incredible news, and it's specifically for a specific type of cancer, as was just stated, hormone-positive, HER2-negative breast cancer, which is actually the most common form of breast cancer. Each year, there's approximately 250,000 new cases of breast cancer, and this type accounts for approximately 70%. So this new clinical trial and this research is bound to help hundreds of thousands, maybe even more patients who are suffering from this diagnosis and giving them a new air of hope.
So how big of a concern is cancer recurrence for patients with early-stage breast cancer?
Well, I think that cancer recurrence is always in the back of the mind of anyone suffering from cancer and thriving and living through their cancer diagnosis. More specifically, with this type of cancer, those who are diagnosed with stage 2 breast cancer, this is hormone positive, HER2 negative, approximately 30% will have a risk of recurrence. And that recurrence can occur at any point in their lifetime. And then if you're diagnosed with later stage 3, approximately 50% of patients who are diagnosed with that get a recurrence at some point in their lifetime. Now, this medication has been shown at its best to reduce that risk of recurrence by more than 25%. So that's monumental.
And where does this treatment fit in the broader fight against breast cancer? How well are we doing in terms of research and treatments in, I guess, what is still the most common cancer among women, right?
Yep, absolutely. Every single day, there's more research, more data, more interventions that can help more people. Now, this medication is going to be seen as an additive to what we already know to be helpful and effective. As far as what was just stated, things like chemotherapy, hormone therapy. This specific medication works by blocking those cancer cells and doesn't allow them to multiply. It is important, however, to understand the side effects. Most commonly noted are nausea, vomiting, headache, and also it can decrease your white blood cells, which are really important to help you to fight infection. So that's important to understand for surveillance or monitoring, of course, to make sure that we have the highest level of efficacy and safety.
All right, Dr. Sutton, appreciate you being with us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.